This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Rubired FCM injection is an effective treatment for iron deficiency anemia. It is used when oral iron supplements are not suitable. Indications and uses. This injection is indicated for managing iron deficiency anemia in adults and children over 14 years who cannot take oral iron supplements due to intolerance or other medical conditions. It is particularly beneficial for those requiring a quick iron boost in cases of chronic kidney disease or when a rapid response is necessary. How it works. The injection works by releasing iron from a complex, which then aids in the synthesis of hemoglobin and enhances red blood cell production. Directions for use. Rubired FCM injection will be administered by a qualified healthcare provider either as an intravenous injection or infusion. The physician will determine the appropriate dosage and duration based on the patient's age, body weight, and severity of the iron deficiency condition. Possible side effects. Common side effects may include headache, dizziness, flushing, high blood pressure, nausea, and reactions at the injection site. It is advisable to consult a physician if symptoms worsen. Precautions and warnings. Caution is advised when using this injection in pregnant or breastfeeding women, as well as in patients with chronic kidney or liver diseases. Individuals with a history of allergies to ferric carboxymaltose or other injectable iron preparations should avoid this treatment. FAQs. 1. What is the use of this injection? It is used to treat iron deficiency anemia. 2. How long does it take to see results? Improvement may be noticed within a few days to weeks. 3. Are there side effects? Yes, common side effects include headache and nausea. 4. Can it be used during pregnancy? Only if clearly necessary and after consulting a doctor. 5. Is it safe for elderly patients? Caution is recommended for elderly patients. Thank you for watching. If you have any questions or suggestions, please leave a comment below.